Hello everyone and welcome to this video about H5N1, also known as the avian influenza virus. This virus has been a cause of concern for many years, as it has the potential to cause a pandemic that could result in a high number of fatalities. In this video, we will explore what H5N1 is, how it spreads, the symptoms it causes, how it can be prevented and treated, and the efforts that have been made to contain it. What is H5N1? H5N1 is a type of avian influenza virus that was first identified in birds in Hong Kong in 1997. Since then, it has spread to other parts of Asia, Europe, and Africa. The virus is primarily found in birds, but it can also infect humans and other animals. H5N1 is a highly pathogenic virus, which means that it can cause severe illness and death in both birds and humans. How does H5N1 spread? H5N1 is primarily spread through contact with infected birds or their droppings. People who handle infected birds, such as poultry farmers, are at a higher risk of contracting the virus. The virus can also be spread through contaminated surfaces, such as cages or equipment that has come into contact with infected birds. Human-to-human transmission of H5N1 is rare, but it can occur in certain circumstances. For example, if a person comes into close contact with an infected individual who is coughing or sneezing, they may be at risk of contracting the virus. However, the virus is not easily transmitted from person to person, and most cases of H5N1 in humans have been linked to contact with infected birds. What are the symptoms of H5N1? The symptoms of H5N1 are similar to those of other types of influenza, but they tend to be more severe. Symptoms typically appear within 2 to 8 days after exposure to the virus and can include fever, cough, sore throat, muscle aches, and headache. In severe cases, the virus can cause pneumonia, acute respiratory distress syndrome, and multiple organ failure, which can be fatal. Who is at risk of contracting H5N1? Anyone who comes into contact with infected birds or their droppings is at risk of contracting H5N1. Poultry farmers, bird handlers, and people who work in live bird markets are at a higher risk of exposure to the virus. People who live in areas where H5N1 is endemic are also at risk, as are travelers to those areas. How can H5N1 be prevented? Preventing the spread of H5N1 requires a multi-pronged approach that includes measures to control the virus in birds and to limit human exposure to infected birds. Controlling the virus in birds. Controlling the virus in birds involves measures such as vaccinating birds. Vaccination is one of the most effective ways to control the spread of H5N1 in birds. Vaccines are available for use in poultry, and many countries have implemented vaccination programs to reduce the incidence of the virus in birds. Quarantining infected birds. Infected birds should be isolated and quarantined to prevent the spread of the virus to other birds. Culling infected birds. In some cases, infected birds may need to be culled to prevent the spread of the virus. Limiting human exposure to infected birds. Limiting human exposure to infected birds involves measures such as avoiding contact with infected birds. People should avoid contact with infected birds, their droppings, and contaminated surfaces. Using protective equipment. People who handle infected birds, such as poultry farmers and bird handlers, should wear protective equipment, such as gloves and masks, to reduce their risk of contracting the virus. Properly cooking poultry. Poultry should be cooked thoroughly to kill any viruses that may be present. Washing hands. People should wash their hands thoroughly and frequently, especially after handling poultry or coming into contact with surfaces that may be contaminated with the virus. How is H5N1 treated? Treatment for H5N1 is similar to treatment for other types of influenza. Antiviral medications, such as oseltamivir and zanamivir, can be used to treat H5N1, but they are most effective when given within 48 hours of the onset of symptoms. In severe cases, hospitalization may be necessary, and patients may require supportive care, such as oxygen therapy or mechanical ventilation. Efforts to contain H5N1. Efforts to contain H5N1 have been ongoing since the virus was first identified in 1997. These efforts have included surveillance. Governments and international organizations have established surveillance systems to monitor the spread of H5N1 in birds and humans. Vaccination programs. Many countries have implemented vaccination programs to reduce the incidence of H5N1 in birds. Public awareness campaigns. Public awareness campaigns have been launched to educate people about the risks of H5N1 and how to prevent its spread. Quarantine measures. Infected birds in areas where H5N1 has been detected may be quarantined to prevent the spread of the virus. International cooperation. Governments and international organizations have worked together to coordinate their efforts to contain the spread of H5N1. Conclusion. In conclusion, H5N1 is a highly pathogenic avian influenza virus that can cause severe illness and death in both birds and humans. The virus is primarily spread through contact with infected birds or their droppings, and people who handle infected birds are at a higher risk of contracting the virus. Preventing the spread of H5N1 requires a multi-pronged approach that includes measures to control the virus in birds and to limit human exposure to infected birds. Treatment for H5N1 is similar to treatment for other types of influenza, and efforts to contain the virus have been ongoing since it was first identified in 1997. By working together and taking preventative measures, we can reduce the incidence of H5N1 and prevent a pandemic that could result in a high number of fatalities. We hope that you've enjoyed today's video. Please like and subscribe to our channel. Thanks for watching.